Hello everyone, I will discuss today cell injury, which is very important topic. So this is the overview of the cellular response to the various stress and the noxious stimulus. In the normal cell, homeostasis is maintained, but under the stress or the injurious stimulus, cell can undergo the state of adaptation or cellular injury. If the stress is mild, cell can adapt. But if the stress is severe, the cell is unable to adapt. It can go to the state of cell injury. So cell injury can be reversible or irreversible. If the stimulus is mild or transient, then the cell injury is reversible. And in reversible cell injury, cell can go back to that normal state. If the injurious stimulus is severe and progressive, the cell go to the state of irreversible injury, and after the irreversible injury, the cell can progress to the state of cell death, which can occur by necrosis and apoptosis. So you can see this is the normal myocyte. In case of increased load, the myocyte go to the state of adaptation, and this adaptation is in the form of hypertrophy of the myocyte. You can see here grossly also there is hypertrophy of the cardiac chambers. You can see here hypertrophy of the cardiac chambers. So this is the ventricle, this is the atrium, this is the crescent shape atrium, this is the ventricle. So in case of adaptation, there is hypertrophy of the muscle fiber, which can be seen grossly at the hypertrophy of the cardiac chambers. In case of cell injury, which can be reversible or irreversible, in case of irreversible cell injury, it can progress to the state of cell death. Cell death. There is disarray of the muscle fibers, disarray of the muscle fiber. You can see here, and you can see grossly this yellowish area. This represent the cell injury. This represent the irreversible cell injury. So, what are the causes of the cell injury? There are various causes of the cell injury. First one is oxygen deprivation. So, the oxygen deprivation can be due to the many reasons like ischemia, decreased oxygen carrying capacity of the blood, severe blood loss, cardiorespiratory failure, inadequate oxygen exchange. So, this is the first cause of the cell injury, that is oxygen deprivation. Second one is physical cause, that can be due to the mechanical trauma, burn, deep cold, severe cold, barotrauma, radiation, electrical injury. So these are the physical causes of the cell injury. Cell injury can be due to the chemical and the drugs. So these chemical and drugs includes the electrolyte imbalance, acid-base imbalance, poisons, pollutants, pesticide, alcohol, and therapeutic drugs. So there are some other causes of the cell injury that can be nutritional, infectious causes, immune reactions, and genetic dearrangement. In nutrition, it can be due to the undernutrition, overnutrition. Infections can be due to the bacteria, virus, fungi, or parasites. Immune reaction can be autoimmune, alloimmune, or hypersensitivity reactions, and genetic dearrangement can be inherited or acquired. So, these all are the causes of the cell injury. So, how the cell injury progress to the cell death? So, this is the normal cell. We can see this is the normal cell. In case of reversible cell injury, there are the membrane blebbing, formation of the myelin figures, there is swelling of the endoplasmic reticulum and the mitochondria. So, in case of reversible cell injury, cell can go recover and go to the normal state. But in case of irreversible cellular injury, cell can progress to the state of cell death. So, in irreversible cell injury, there are formation of the myelin figures like the reversible cell injury, but there is breakdown of the plasma membrane, organelles, and nucleus, and there is leakage of the contents. And there is amorphous density in the mitochondria. There is amorphous density in the mitochondria, and in case of necrosis, there is surrounding inflammation. In this graph, you can see the effect and the duration of the injury. So you can see the cell function declines as the duration of the injury increases. And the earliest marker is the biochemical alteration. Earlier marker is the biochemical alteration. Then is the ultrastructural changes, which you can see by the electron microscopy. And as the time progresses, there are light microscopic changes and the gross morphological changes. But at the time of detection of the gross morphological changes, the duration of the injury has been reached a lot along. So this is the question. Which event best marked the transition from the reversible to irreversible cell injury? The option is cellular swelling, then fatty change, loss of mitochondrial membrane integrity, and the decreased ATP production. So the answer of this case is loss of mitochondrial membrane integrity. So I have discussed this graph and this normal cell and the causes of the cell injury. Now I will discuss the reversible cell injury. So the characteristics of the reversible cell injury is cellular. Firstly, there is cellular swelling, there is plasma membrane alteration, there are mitochondrial changes, which I already discussed. There is accumulation of the myelin figures, there is dilatation of the endoplasmic reticulum, there are nuclear alteration. So these are the tubules. You can see these are the tubules. You can see these microvilli. You can see this brush border villi. You can see, but there is, so you can see there are some nuclear loss here. There are some nuclear loss here. You can see here there is some nucleus. In the second picture, you can see the cellular swelling. You can see the cellular swelling, and there is loss of brush border epithelium. There is loss of brush border epithelium. And this in liver microscopy, you can see the liquid accumulation, which presented in microscopy as macrovascular steatosis. Macrovascular steatosis. So this is the electron microscopy of the renal tubular epithelial cells. In the normal tubular epithelial cells, we can see the intact microvilli. We can see the intact microvilli, and these are the these are the mitochondria. These are electron dense mitochondria. So in the reversible injury, there are loss of the microvilli. There is loss of the microvilli, and there is blebbing. There is blebbing. There is blebbing. And there is, these mitochondria are electron dense. These are the electron dense mild swollen mitochondria, and these mitochondria are electron dense and swollen. In the irreversible injury, there is also loss of the microvilli. There are many blips. And there are markedly swollen amorphous electron dense mitochondria. There are Markley is swollen, electron dense mitochondria. So this is the question for you. Which of the following changes is the earliest and the most reversible in the hypoxic cell injury? The options are nuclear pyknosis, plasma membrane rupture, cellular swelling, and the karyorrhexis. So the answer for this is plasma membrane rupture. So I have discussed the causes and the presentation of the reversible cell injury. Now I will discuss irreversible cell injury. So in irreversible cell injury, firstly I will discuss the necrosis. There are cytoplasmic changes in the necrosis and nuclear changes in the necrosis. In cytoplasmic changes, there is increased eosinophilia, which is due to the loss of RNA, accumulation of the denatured cytoplasmic proteins, and these protein has affinity for the eosin dye, which gives pink color. So there is increased eosinophilia in the cytoplasm. And there is glassy homogeneous appearance of the cytoplasm due to the glycogen loss. And there is more Thetan vacuolated cytoplasm, and there are myelin figures which are formed due to the membrane disruption, phospholipid breakdown. So these are the cytoplasmic changes. Now there are nuclear changes. Firstly there is pyknosis, then karyorrhexis, and then karyolysis. So in the pyknosis there is nucleus clumping, shrinkage of the nucleus, and there is increased basophilia of the nucleus. Nucleus shrinkage, clumping of the nucleus, there is increased basophilia of the nucleus. So in karyorrhexis, the chromatin condenses into dense shrunken basophilic mass. Then there is fragmentation. Rhexis means fragmentation. So after this, there is karyolysis. There is basophilia of the chromatin fades due to the loss of the DNA. Due to the loss of the DNA. So this is the normal cell, and these are the cytoplasmic changes in the necrosis. So, and these are the nuclear changes in the necrosis. We can see the pyknosis, dense clumped nucleus. In karyorrhexis, there is fragmentation of this nucleus. This is fragmentation, and karyolysis, this fades down this basophilia, fades down this basophilia. So, what are the type of the necrosis? Necrosis can be coagulative, liquefactive, caseous, fat necrosis, fibrinoid, and gangrenous necrosis. These all are the types of necrosis. Firstly, I will discuss the coagulative necrosis. So, in coagulative necrosis, the architecture of the dead tissue is preserved, and it occurs in a span of days, and it has firm texture. So in this injury, the injury denatures the protein and the enzymes and blocking the proteolysis of the dead cells. So in this picture you can see the outline of the cell. Like you can see that at one stage of this time there may be one cell. You can see the outlines. Like architecture of the dead tissue is preserved. You can see this, and these are the live cells. So, in cognitive necrosis, there is eosinophilic anucleate cells that may persist for days or weeks. And ultimately, the necrotic cells are removed by phagocytosis of the cellular debris by the infiltrating leukocytes. This is the cellular debris, blue color you can see the debris. This is the cellular boundaries you can see. Intense eosinophilic. These are the live cells. So now I will discuss the liquefactive necrosis. This is This necrosis occur due to the digestion of the dead cells. In this transformation into dead cell into the liquid viscous mass, and it is creamy yellow because of the presence of the dead leukocyte, that is pus, and can be seen due to the bacterial and some fungal infection, and it is seen in the brain hypoxic injury. You can see this brain hypoxic injury. You can see this liquid viscous mass. You can see the liquid viscous mass. So the liquefactive necrosis is seen in the brain. Next is caseous necrosis. So caseous necrosis is seen in the tubercular infection, as you all know. Caseous means cheese-like. This is caseous means cheese-like, referring to the friable yellow-white appearance. Cheese-like friable yellow-white appearance. So necrotic focus appears the collection of the fragmented or lyse cells with amorphous granular pink acellular material. Outlines cannot be discerned. Alright, be discerned as you have seen the coagulative necrosis. You can the tissue structure is preserved, but in this the outlines can't be discerned. So in this caseous necrosis, you can see the central caseous material, then surrounded by the collection of the macrophages, inflammatory cells, giant cells, epithelioid cells. You can see in this necrosis. But tubercular necrosis can be mostly it is caseous, mostly, but it can be non-caseous in few cases or rare cases. Now coming to the fat necrosis, there is focal destruction of the fat, and there is activation of the, it is seen in the pancreas, like you can see this yellow is light yellow areas, light yellow, this is fat necrosis, light yellow areas. So in the pancreatic fat necrosis, there is activation of the pancreatic lipase. Activation of the pancreatic lipase. You can see these fatty cells. You can see this. This is the pancreas with the fat necrosis. Now I will discuss the fibrinoid necrosis, which is seen in the blood vessels. You can see this highly pink intense eosinophilic material. This is the fibrinoid material. So there is deposited immune complex and plasma of protein that leak into the wall of the damaged vessels, producing pink amorphous appearance of the H stain. Now discussing about the gangrenous necrosis. So we usually apply the term gangrenous necrosis to the limb, journey to the lower limb, because it has lost its blood supply and undergone necrosis. So, so when bacterial infection is superimposed, there's more liquefactive necrosis because of the action of the degrading enzymes in the bacteria and the attacked leukocytes, giving rise so-called wet necrosis. Wet necrosis. So now next type of cell death is, I have discussed the necrosis, type of necrosis. Now I will discuss the apoptosis. But now I am thinking to discuss it tomorrow. Okay, thank you.